Hello, my name is Dr. Gina Coombs, and I am an assistant professor in the Irene Ransom Bradley School of Nursing at Pittsburgh State University, which is located in Pittsburgh, Kansas. I am sure as a high school student, you have been asked the question, what do you want to be when you grow up? Well, today I would like to explore a career in nursing with you and give you a little bit of information about what nursing has to offer. So let's go ahead and get started. So a little bit of information about me. Like I said, I am a nursing instructor at Pittsburgh State University, PSU. We are home of the gorillas. So you can see the split face gorilla at the bottom of the screen. I actually have been a nurse educator here since 2010. I have a long history with PSU. I graduated from PSU with my Bachelor of Science in Nursing degree in 2006. And after that, started working as a nurse in a medical surgical nursing area. So what that is, this would be in a hospital setting for patients that have been diagnosed with a medical condition, and we help take care of them, or maybe they've had surgery and then we help in the post-op period and get them back to their optimal health, and then they get discharged. So that is the area of nursing that I have focused on since 2006, and actually the area that I'm currently teaching at PSU as well. I then went on to school at PSU again with a Master of Science in Nursing degree. This is an advanced practice degree in 2009, and then started at PSU in 2010. And then went on again. It seems like I've had a lot of schooling. I got a PhD in nursing in 2019 from the University of Missouri, Kansas City, UMKC. And this focus was really to help me become a better researcher as part of my job as a nurse educator. And also the focus with this was to help with curriculum development and provide me with better strategies for teaching nursing students. So even though med-surg nursing is still kind of at the heart of what I do, my passion very much is teaching and educating the future nurses in the United States and in this area. So why did I choose nursing? I actually decided I wanted to be a nurse pretty early on. I was about 9 years old and I had gotten sick and was hospitalized. And I had a nurse that just really made an impact on me and made that hospital stay a little less frightening as a young kid. And I remember saying to my mom and dad, I want to do this when I get older. I think I want to be a nurse when I grow up. What I have found is that this career is incredibly rewarding. Anytime that you have a chance to help others who are sick and to make them, feel comfortable and to earn your trust as you care for them, and then to see them get better and get discharged and get back to their optimal state of health is just incredibly rewarding. You'll hear a lot of people say that nursing, you're helping people, but you don't understand when you first start the career how much your patients give to you in return. So that's just a wonderful piece of this career. I absolutely love science. I love anatomy and physiology. I love learning about the human body and how it works. So that kind of combination of wanting to help people and also loving the science piece behind this was just the kind of the difference for me in deciding what I wanted to do. This absolutely is a career with endless possibilities, and that's one of the things I want to talk to you about. I want to talk to you about the job market currently. And you can get a job anywhere. You can work in any type of area that you would like. And let's say you work in a certain area for a while and then you want to move to another area of nursing, that opportunity is there. So it's like you never get bored in this career. And there's really a lot of good benefits that come along with it. Like I said, this was an opportunity for me to help make a difference in the lives of patients, and that was a big piece of why I chose this. There's good career advancement. You can go on and become a nurse practitioner or a nurse educator, or maybe you want to help deliver babies and work right there with a physician. So as a nurse midwife, so that's a good area or good reason as well. So I knew I might want to go on and become a nurse educator. So that career opportunity was there. When I started in school, in college, there was a big nursing shortage. And in 2020, now 2021, what we are still seeing is we still have a nursing shortage. So that opportunity to get a job anywhere you want is there. And there are a lot of careers that you don't see that. Someone might graduate from college and then have a hard time finding a job. So this career is definitely one where you might get a job, or you probably will get a job before you even graduate from college and from a nursing program. So, what is a registered nurse? So, we call them RNs, and this is an individual that has graduated from a state approved nursing program. They have passed the certification test. They call it the NCLEX RN, and they are licensed as an RN by a state board of nursing to be able to provide patient care. So, the National Council for State Boards of Nursing, they are the board of nursing that does the certification test and that licenses you as a nurse. And then that goes through the state board of nursing wherever you live. So we have two degrees. Let's say you're thinking about nursing, maybe you're getting ready to graduate from high school. There are two options that you can choose from. There's an associate degree in nursing. We refer to this as an ADN. This is typically a 2-year nursing degree at a community college. So instead of taking a couple of years where you do like prerequisites or some general education classes, you actually will take those concurrently with nursing courses. So in 2 years, you graduate, you take that NCLEX exam, and then you become an RN. The other option is a Bachelor of Science in Nursing. We refer to this as a BSN. So this is a 4-year nursing degree at a university. And the first 2 years are your prerequisites and your general education. And then the last 2 years are your nursing classes when you're actually in the program. So, if let's say someone did do the associate degree in nursing and got the ADN, they started working as an RN, they can go back and get the Bachelor of Science in Nursing. So, they can continue on and do that. And it takes a little less time. It's about a year because you're already have a nursing degree. And there are programs that offer that. PSU offers that as well. So those are the two degrees that you're going to see as a registered nurse, and two degree areas when you're looking at programs to go into after high school. So, what is the role of the nurse? What do we do? So, obviously, we care for the physical, mental, emotional, and spiritual well being of a patient. So, whether that's in a hospital, in a nursing home, maybe in a school, you have school nurses that are working with kiddos and students every day. So, it's not just the physical, it's also the mental, emotional, and spiritual well being. We want to make sure that we get patients back to their normal state of health. And we do everything that we can to get them there. Part of that is to monitor and assess a patient's condition and provide care based on their healthcare needs. So, a primary care provider, like a physician or a nurse practitioner, is going to decide, what is the patient's diagnosis, what all do they need, and then nurses will help implement that care and administer those medications, administer those treatments that maybe that patient needs. One of our roles is to advocate for patients, especially when a patient cannot advocate for themselves, or maybe they don't have any family around that can help them and to speak up. So, COVID-19 and this global pandemic that we're in is definitely one of those times where nurses are advocating for patients. When an individual is on a ventilator with COVID and their family cannot come into the room, this is an opportunity for the nurse to really advocate for them, to make sure that they're getting what they need. When you have medical providers like a physician or nurse practitioner, they might be with the patient for a very small period of time, but the nurse is going to be with a patient throughout the whole day and spends a lot more time with that patient. So they're aware more of what they need and to speak up for them. We also educate them on their health condition, on their medications, on their treatments, and make sure that they know, the information that they need. You will hear all the time that nursing is both an art and a science. And obviously, the science part we understand. But the art part of it is being able to provide compassionate care to all of your patients, and you're making a difference in their lives. So that's the art of it and the beauty of nursing. So we have a lot of roles as a nurse, and we'll talk about what area can you be in. And honestly, as I made this presentation, I probably could have added a second slide with more areas to choose from, because I know I've missed some. But let's talk about some of the areas of nursing practice that you could be in. The first one, medical surgical units. Like I said, that was the area that I have worked in and my focus area. So taking care of patients that have medical illnesses such as cancer or pneumonia, or maybe had surgery and had their knee replaced, had a total knee replacement, and then we help care for them afterwards. Obstetrics. So this is like the labor and delivery. So if you have a pregnant mom that's going to deliver a baby, you would be the nurse that would help with that delivery. Obstetrics not only includes the labor and delivery part, but it also includes the nursery, which is the care of that newborn baby after they are delivered, and then the postpartum area. And this is for the mom that has just had their baby, so they also need to be provided care after they've delivered a baby. So the obstetrics area is typically a very happy area. It's a very exciting area. Everyone is excited about, the miracle of birth and a new baby coming into the world. Pediatrics. So this is the care of kiddos, whether that's maybe a kid that had surgery and or a kid that might have pneumonia or something like that. And then typically pediatric patients are there for a short period of time. They're not usually in a hospital for a long period of time, unless it's more of a children's hospital, where they might need a longer extended period of time for care. An operating room, or the OR, an outpatient surgery. This would be an area where a patient comes in and they get checked in by the nurse. They go for their surgical procedure. The nurse monitors them after the surgery, and then they go home. So they don't actually stay in the hospital overnight after that surgical procedure. The emergency room, or the ER, this is kind of a critical care area, because you can have patients that come in from maybe a car accident, or maybe some kind of trauma event, or it could be a patient that's having respiratory symptoms and can't breathe or something like that. So you get a lot of variety in an emergency room, and this would be an area that you really get to do a lot of skills as a nurse. The intensive care unit, or the ICU, this is also a critical care area. You have patients that might need a higher level of care. So the nurse might have one or two patients that they're caring for in that unit, because those patients have more things going on. They might be on a ventilator, or let's say they had an open heart surgery, and then they get admitted to an intensive care unit after that. Endoscopy labs. So an endoscopy lab is where we do scopes. We can do a bronchoscopy where we go into the lungs. We can do a colonoscopy, and then nurses are hired in those areas to help prep the patients, and then afterwards for those scopes. We have specialty units. One is cardiology, where we're caring for patients that have heart conditions or maybe had a procedure that involved the heart. So that would be a specialized unit. And we have a lot of those specialized units. You can be a school nurse, and you can work in a school with students and administer medications or any treatments that they need. We are seeing schools hiring more and more school nurses, especially in the time of a global pandemic, because there's more things that we need to look out for. So that is definitely an area that is a good one. You can be a nursing instructor like myself and go into nursing education. Maybe you want to work in a doctor's office, and when you have patients that come into a doctor's office, and you take their vital signs and they're admitting information, maybe administering vaccinations or things like that. A flight nurse. A flight nurse is an individual that helps transport very ill patients, usually either from one hospital to another, or maybe from, let's say there was a car accident and they call the helicopter to come. And then that flight nurse or flight nurses help care for that patient, load them onto the helicopter, and then get them en route to the emergency room for further treatment. So that's definitely an area that's a lot of adrenaline, and you have to know your skills for sure in that area. Community health clinics. So these are your urgent cares, or maybe even like a health department, and areas that you would work with patients similar to like a doctor's office. Long-term care facilities, these are your nursing homes or your assisted living type of areas. We have home health and hospice. So home health is for patients that are still living at home, but maybe they need some nursing care 2 or 3 days a week. So the nurse actually comes to the home, works for a home health agency, and then sees patients in their home and provides care that way. Hospice is for individuals who are considered terminally ill, and the medical provider has stated that they have 6 months or less of life left. So our hospice agencies and our hospice nurses are going to provide care to those patients at the end of their life. Psychiatric mental health. This could involve children. This could involve adults, or maybe our elderly geriatric population that might have some behavioral health issues. So as you can see, there's a wide variety of areas. I could add in here, we have nurses that are traveling nurses and that go to different areas for certain periods of time. And I'll get into that maybe just a little bit more with some of the advantages of nursing, because you can maybe live in Florida for the winter and take in that sunshine and be there for 13 weeks on a travel nurse contract, and then move somewhere else and work somewhere else for 13 weeks. So we have a lot of nurses that do travel nursing, and there's a lot of benefits to it. So I'll talk a little bit more about that in just a minute. We also have advanced nursing practice degrees. So maybe you want to go on after you have been a nurse for a while and you've worked in, maybe multiple areas. Maybe you would like to go on, and these are the 4 areas. A nurse practitioner. This is going to be an individual that is going to be treating, diagnosing patients. So they work under a primary care provider like a physician, and they have a little more responsibility, a little more liability. Anytime you're diagnosing and treating patients, there's more that comes with that. So nurse practitioners, we are seeing hired throughout, pretty much in any specialty area, in the hospitals and the doctor's offices. This is a very popular advanced practice degree. Nurse midwife. This is an area that if you wanted to, maybe you were a labor and delivery nurse and you were in that unit as a registered nurse, but then you went on to midwifery school, and that would be like a 2-3 year program. And then you would be the one that would be delivering that baby, or babies if it's twins or multiples. So you would work directly with that obstetrics physician and be providing care directly to that mom and baby. A nurse anesthetist. So a nurse anesthetist is an individual that would assist putting a patient to sleep for surgery. So they would be providing anesthesia. A nurse anesthetist works directly under the supervision of an anesthesiologist, which is a physician that provides anesthesia to patients. So this is a very popular area. You would be in the OR administering anesthesia to patients. And one of the things that you'll see in a minute is the salary. The average salary for a nurse anesthetist is pretty high, which is very appealing. But there is also a lot of responsibility that comes with that. Anytime you're putting a patient to sleep and you're giving them medication to do so, you also have to make sure that you can wake them up after that surgery. So there is some responsibility that comes with that. And then a nurse educator, which is the route that I chose. And this is, the opportunity to work with students and to be involved in their learning. And I'm not only in the classroom with them, but I'm also in the hospital setting with students. And I still get to work as a nurse and take care of patients, which is really nice. I want to stress that we also have a lot of advanced practice nurses that do multiple roles. So you can be a nurse practitioner, but you could also teach as well. Uh, we have a lot of medical physicians that do this also. They work as physicians, but they teach in a med school and are educating med students. So you'll see that kind of combination occur quite a bit. Another thing I want to point out is nursing used to be considered predominantly a female profession. When I first started college, it was, one of those things that you saw more females go into nursing and decide on a nursing major than males. That has really shifted, and we are seeing more of a balance male female in our nursing program, and that is something that we're kind of seeing throughout nursing practice. So it's no longer just a female profession. This is absolutely a balanced profession of males and females. So if you're a male and you're like, gosh, I do want to consider this, but I've kind of heard that this is more of a female profession. That's absolutely not the case anymore. And we're seeing more of a balance between males and females. Okay, so average salaries for nursing careers. This is, one of those things when you're choosing a profession, you want to know, what's my salary going to be? What kind of money is involved for this type of career? So whether it's nursing or another career, you want to know what the financial aspect is for this career based on the type of life that you would like to live or the lifestyle that you would like. So this information comes from the US Bureau of Labor Statistics for 2019-2020. And these are average salaries. So as you can see for the advanced practice degrees, those are going to be a lot higher. You have more schooling, you're looking at 2 to 3 more years of schooling, more responsibility, more liability. And so, like I mentioned, the nurse anesthesia or the nurse anesthetist have pretty high salaries, but there's a lot of responsibility with that. So, and again, these are averages. And then you have nurse practitioners, nurse midwives, nursing instructors. And then in like the lighter blue area, you'll see the average salary for registered nurses and then the national average. So, these are salaries for the entire nation. This is kind of what you would see. Now, obviously, if there's certain areas that have a higher cost of living, then you're going to see a higher salary for that nurse because the cost of living is more. So that's where you're gonna see the difference and then that national average. An LPN or a licensed practical nurse, LVN is a licensed vocational nurse. This is a nurse that has gone through 1 year of schooling, but did not complete the RN level. So they still have some responsibilities for caring for patients, but they will work directly under an RN, and cannot do the full capacity of what an RN does. So that's why you see a little lower salary. Nurse nurse assistants, also known as certified nurse assistants or CNAs. These are individuals that provide a lot of basic care to patients. And maybe your school also has a CNA program. So you can actually start working as a nurse assistant even before you get to college, and gain some experience in the nursing profession. So this is, just some information to provide you on average salaries for nurses and the advanced practice nurses. Okay, so advantages of a nursing career, there are a lot of them, but I'm going to just kind of touch on a few here. So, flexible scheduling. So, in a normal profession, a lot of your professions are 8 to 5, Monday through Friday, right? They're 40-hour work weeks. Nursing has some variation. Now, obviously, if you're a school nurse, you're going to have your normal school day hours, Monday through Friday. You're off when the school is off and when students are off, Christmas break, spring break, those kinds of things. With hospital nursing, a majority of hospital nursing, you're going to see more 3 12-hour shifts a week. So instead of working 5 8-hour days, you're going to work maybe a 7 a.m. to 7 p.m., so a 12-hour day, but you only do that 3 days a week. So in a 7-day week, you're off for 4 days and you work for three. So it's a 36-hour week versus a 40-hour week. Now, there are some areas like the operating room that might still be an 8 to 5 or a 7 to 4. And then there's other areas that are going to have this 3 12-hour shift type of scheduling. Um, so there's some flexibility, and there's a lot of people that like that because they're off 4 days a week. And it's like, gosh, I can get my 3 shifts in and be done and then have 4 days off, which is wonderful. The other nice thing about flexible scheduling and hospital nursing is you're going to see more self-scheduling. So let's say there's, a wedding or something that you have to go to, you can actually make sure that you're off for that. And there's self-scheduling where you might schedule 2 months in advance and you plug in the days that you would like to work, and then that supervisor would finish putting that schedule together. So there's some flexibility there. The salary, I've talked about that. Sign-on bonuses. So this is an area that I would like to touch on because not all professions are seeing sign-on bonuses. So as a nursing instructor, we get a lot of hospitals and healthcare agencies that come to PSU and recruit our students to work at their facility. And this typically happens in their last year of the nursing program. And so we hear a lot about what benefits do they have. Sign-on bonuses are currently a big one. So let's say, a facility says we'd like to hire you on. We are going to offer you a $10,000 sign-on bonus if you sign a contract and work for us for 2 years, or a $5,000 sign-on bonus if you sign a contract and work for us for 1 year. That means you sign the contract and they will pay you that sign-on bonus. And that just doesn't happen in a lot of professions. And so that is a huge advantage to nursing and choosing nursing. The other one is tuition reimbursement. So when you go to work for a facility, they might have tuition reimbursement. So if you took out loans for college and you owe money back from college, the some facilities will have some reimbursement that can go towards your loans and help you pay that back. Another thing is they will pay for you to take your NCLEX examination, and they will actually pay 8 hours of pay when on the day that you go to take the exam. So not only are they paying for the $250 fee for the exam, but then they're going to pay you for 8 hours just to go take the exam. The exam's not going to take 8 hours to take, but you get a full 8 hours of pay, which is just another benefit and something that we're seeing. So students have a lot of options when they're looking at different facilities and which way they want to go based on all of these extra things: tuition reimbursement, sign-on bonuses, the hourly pay, overtime pay, things like that. You can work anywhere in the world. So no matter where you want to go, maybe you want to get an international license and work in Europe. You can do that and still be working as an RN. Or like I said, with travel nursing, you can work in certain area for 13 weeks, and then you can move to a different area. In March, when the pandemic, March of 2020, when the pandemic really started, and New York was a high hit area for COVID, nurses were getting very large bonuses and payments to go work in New York at their hospitals and to help with this pandemic. So I actually had several individuals that I went to nursing school with that left for their family and their work for a period of time and went and worked in New York as a nurse practitioner or as an RN until they could, kind of get everything under control. So that opportunity is there. I've mentioned this several times, but it's just something that needs mentioned again, and that's the rewarding feeling that you get when you help caring for others and you have the chance to really impact a patient's life and their care. Career advancement and moving up the ladder and becoming a nurse practitioner or a nurse midwife, and that this is really a team focused environment. So no matter what area that you're in, it's not just you by yourself. It's the healthcare team, it's the physician, the nurse practitioner, the nurse, maybe the respiratory therapist, the nursing assistant, the nutritionist. You have this healthcare team that's behind you, and the goal is to make sure that the patient gets what they need and everyone has the same goal. So you always have a team behind you, which is really nice. So, what can you do now? As a high school student, what can you do? If you're really thinking about nursing, or maybe you're like, gosh, this really kind of sparked my interest, but, Gina, where do I go from here? No matter what career you choose, work hard in your classes. Okay, get good grades in your courses and in your high school classes. Study, work hard, talk with your teachers. If you're interested in maybe some more science classes, maybe talk with your counselor or with some of those teachers about getting into some of those courses. Those upper level science like A&P and chemistry and your upper level biology classes are going to be really helpful if you are looking at nursing or maybe even another career in healthcare. Talk with your parents, talk with your teachers, your counselors. There are classes in some schools that focus on health science careers, or some science investigation type classes. So that might be an opportunity for you to explore, get in one of those classes, and become more familiar with a career in healthcare. You can schedule a campus visit to a college's nursing program, and you can discuss admission requirements. So PSU, we do campus visits for high school students of, it could be a freshman, sophomore, junior, or senior, it doesn't matter. You can schedule a visit. So how that works is it's usually through the admissions office with that school, and they will talk to you about the school just in general, and they'll take you on a tour. And then if you're interested in nursing or a certain major, then you have the opportunity to sit down with a faculty member in that area. So when we have high school students that visit BSU and they're interested in nursing, we actually take them through the nursing school and we talk to them about the admission requirements. What all do they need? We talk about like their first 2 years of prereqs, And some students come in with college classes already done. That's great too, but you don't have to. So we can, kind of develop an individualized plan for each student based on if they've had college classes or not. We also talked to them about the clinical and the nursing program, the last 2 years of college for them, what all that would include, and some of the experiences that they would have. We take them through our simulation lab. Simulations are one of those areas in nursing, and you're going to see, and gosh, your high schools might even have some simulators, but these are like live mannequins that they can talk, they can breathe, they can stop breathing. We can actually like perform chest compressions on them. They can urinate, they can hemorrhage and bleed. There's a lot of things that we can do. They're very expensive, high fidelity mannequins, but they provide nursing students with a chance to practice on not a real patient before they would actually get to the clinical setting and do it with a real patient. So usually when students will make campus visits or schedule a campus visit, we will show them our simulation lab, which is one of the key things to our nursing program. You can become a certified nursing assistant, and which is a CNA. That's actually how I started. Became a CNA, started working as a CNA, took a science investigations class through my high school, and I started job shadowing a nurse. Now, in this current global pandemic, job shadowing a nurse is a little more difficult. Pre-COVID, we could do that a little easier, but in this current situation with COVID, you're not seeing as much opportunity for job shadowing, but hopefully in the future that will come back and we'll be able to do that more. So those are some things that you can do now to help prepare for a career in nursing and maybe provide you with a little more opportunity to consider the next step. So and I just want to thank you for letting me visit with you about the nursing profession and what all it has to offer. If you are interested in PSU's nursing program, please feel free to email me. My email is provided. If you would like some just general information about PSU, the website is listed here. And good luck with all of your future endeavors. And thank you for letting me visit with you.